The New Year's morning murder is drawing a lot of attention to emergency services in the country. Tonight, Angie Toussaint talks about the paramedics department of the Myrtle Rigby Health Complex and how improvements to the service are in the works.
They are called to assist in the event of an emergency, but according to some residents, they are not always efficient when delivering service. Director of Medical Services, Dr. Rufus Ewing, at a recent press conference, explained the reason for the seeming lack of response when it comes to the country's paramedics and what the medical department plans to do to correct all problems associated with the department.
Yes, we've been having some problems from time to time with ambulance in terms of its maintenance, in terms of it being able to start immediately. We have three ambulances on site, and from time to time you may have one or two of those that because of lack of certain maintenance may not be able to respond, and you have to use alternative ambulance that you have available. So that sometimes can lead to a delay in response.
Dr. Ewing explained that all paramedic and nursing staff are certified. He said they have all been trained in their respective professions on how to cope with patients involved in traumatic incidents and how to stabilize one during an injury.
Even though we have 3 ambulances, we only have one ambulance crew who's on staff at any one particular time. So if there's an ambulance call up in Leeward, and you have the ambulances up in Leeward responding to a call, and you get another ambulance call in Wheelan, in Blue Hills, then it's almost virtually impossible sometimes to have both responding at the same time in an appropriate manner. So that in itself could lead to response. So yes, we are rapidly developing country, rapidly developing island, and the level of emergencies that we are facing right now is definitely surpassing the capacity to fully respond to all of the emergencies.
Director of Medical Services said that the progress of the 2 new hospitals and other initiatives brought on by the medical department will assure that all of these problems be rectified.
There are 2 initiatives that are being dealt with at the moment, and one of the initiatives is the development of an effective 911 system that is being looked at, and the second one is the improvement of the ambulance services, where we'll have more paramedics, emergency medical technicians on staff, and better ambulances that are capable of running the runs from different events.
A reliable protocol is being set for the medical department, and by 2008, according to the Director of Medical Services, will be established so that there be no more worries by residents. For WIV4 News, I'm Angie Toussaint.